This morning we're interviewing Mary Halstrom. Mary has been a nurse in Warren County with the Public Health Department for many years, and we're just very excited to talk to her on this warm September day in 1987. Mary, you graduated from Owensboro Davis County Hospital School of Nursing in 1940. Nursing has changed a lot in those years, especially the way we train our nurses. Can you tell us about what a typical day in your nursing school was like?
Well, we lived in a dormitory, and I think there were finally 14 nurses that graduated in my class. And that was the first year that they had a midterm class. They had another class that graduated the following January. But when we first went in school, we went to school for 6 months, 6 or 8 hours a day. And we learned, we had hard subjects. We went to school from 8 to 4, and 1 to 3, and 6 to 8. And in between, we would go on the floor and learn different procedures that we had learned in the schoolwork. And of course, after 6 months, I guess we were capped. And then you were over your probation, so you felt like you were home free. And then you went on the floor as a nurse. And you had so many patients that you had to do everything for. You had to give medicines and give their baths and take their flowers out and cut them and put fresh water in. And it was just really an all-around program of taking care of the whole person as a patient. And then at that time we went to work at 7 o'clock, and they called it 12-hour duty, but you got off from 1 to 4 to rest, and then you went back and stayed to the rest of your 12 hours. But I hadn't been in school very long till they changed that to 8-hour duty. And then you had your regular shifts, 7 to 3, and 3 to 11, and 11 to 7. And you had a lot of responsibility, and you had to go through all the services, OB, surgical, medical, diet kitchen, x-ray, you name it, we had to go through it. And then you had to scrub for so many surgeries. And many times I've even first assisted the doctor because they didn't have a partner. And that was awful.
That was during your surgical rotation.
Yeah, right. One time they had a brain surgeon that was flown in here during the war. Dr. I believe his name was Sperling. He was well known. And he was flown in here, and I had to scrub for that. And I never did. I always had fairly bad eyes. I wear glasses that I can see well, but they had such little sutures that I asked God to help me get through that. I could hardly see the sutures when they'd ask for it. And I asked God if he'd let me get through that. I wouldn't be a surgical nurse.
Oh, that's interesting. So you said after 6 weeks you went on the unit then to care for the patients?
6 months, I think it was. Maybe 3 months, I'm not sure.
But it was early on.
Yeah, it was early, yes. But then, of course, you had supervisors that went around to be sure you knew exactly what you were doing. And then after they had confidence that you knew how to do it, they didn't follow you around as much and help you.
Well, especially when you had your 12-hour duty, there wasn't anything you did but nurse.
Yes.
So I think those of us who went to school quite a while ago can identify that there was no other life except your nursing, was there?
No. You had to
You
be
didn't have a social life, really.
You had to be in at 10 o'clock at night. And the only time, maybe by the second year, you could have your evenings free if you didn't have any night duties or anything, or evening duties. one time my sister came over to take me out to eat, and I hadn't slept for 3 days and nights. I've been on OB and surgical call, and I never was sickly looking. I had circles under my eyes, and she said, "What have they done to my sister?"
You probably were too tired to eat.
And we went. No, you couldn't. We went to. You remember when Gone with the Wind came, and it lasted past 10 o'clock at night. I guess we went at 7 or 6. 4 hours, I think. And so we had to get special permission to be late that night when we went to see Gone with the Wind.
Oh, that's an interesting story.
Yeah, it was really something, because they wanted us all to go see it.
Was your dormitory right attached to the hospital?
Yes, it was attached to the hospital. And when I was first over there, I could hear the mothers crying when they were in labor, and I just thought that was the awfulest thing. I didn't think I'd ever want to have any children.
After hearing that. How old were you when you went?
I was 18.
Right out of high school. So you worked weekend duty and as a student?
Yes. Oh, yes.
How many days off? Did they give you any complete days off during that time?
I think we got 1 day off, complete day off. But most days you had some duties. And then if you had a day off, you had to go to class. So that really wasn't
a day off.
You
had to go in summers as well.
Oh, yes. Yeah, and if you missed any days because you were sick, at the end of the time you had to make it up. And I didn't get any vacation my last year, and then I was late getting out of school in September because I had my appendix out, and I was off. And that's the only sickness I was off the whole. I had my appendix out at Children's Hospital in Louisville when I was taking my pediatrics in Louisville.
Oh, my goodness. So where were your affiliations then? You went to Owensboro for your general. Then did you go? You went
the
to
only
Children's?
Other place we went was Children's.
Where did you do your psychiatric right there?
We didn't have psychiatric. It was. We had plenty of them, but wasn't.
Oh, you didn't go to
psychiatric hospital. No.
So we were always glad when it was over with. It seemed like a long 3 years.
Yes. I really flubbed though. I missed I was the only nurse that was offered a scholarship to Transylvania College, and I thought that I needed to get out and go to work.
When you were through
when I was
nursing,
through,
you were offered that.
Yeah, and I was the only one that was offered, so I often wondered what it would have been like if I hadn't have, because I had a scholarship. I had to work in a clinic, in a setting for sick students part of that time, but I would have had a good education.
Oh, man.
And I probably would have ended up making more money
than at the health department.
Than wherever I worked, because the first job I had, I made $65 a month, and my board and my uniforms laundered.
So where did you go to work then when you graduated in 1940?
I went to Booth Memorial Hospital in Covington. I worked a lot of different places.
And that was just before the war there. And so you went up to Covington to work.
And then I went to Kansas.
Did you know anybody there?
Yeah, I had a sister that lived close. And my brother-in-law got me a job. Of course, I'm sure I could have gotten a job.
Oh, yeah.
And then I did private duty part of the time.
How long did you stay there?
Probably 6 months. And then I went to Kansas City, and I went to work at St. Joseph Hospital. And that's when I applied for public health before I got out of school.
So you thought you would like that area?
Yeah, I thought I would like it before I had a little bit of public health practice. I went with a doctor over there to deliver babies out in the homes. And
this was during your training?
Yeah, during my training. Well, right after I got out, before I was licensed, before I took my state board. And I did several different, and I thought I would like that, but This doctor had always wanted me to go to work for him, but I didn't go to work for him, but I would go on calls with him. And then when I went to public health, you know, we had this service in Bowling Green, delivered babies in the home, so.
Well, that's interesting. Well, what made you go to Kansas City?
I had two brothers that lived there. But see, what made me go to Kansas City to work, I graduated from high school there. I went there when I was a junior in high school, went my junior and senior year. I will have graduated from, I did graduate in 1937 in June. And last year we came through Kansas City and my husband stopped and took a picture of the high school. And that school was still standing. And my husband said if that was in Kentucky, they'd had that building torn down long ago. And they're still using it.
Still using it in Kansas City.
And see, I always thought that I would like to live in Kansas City because I went there, you know, while I was a teenager to go to school, and I loved it. So I went back and worked out there, and then that's when I got my call to public health.
I see. So you worked in public health in Kansas City?
No, just in the hospital. But the people here called me.
Called you back.
Mm-hmm.
Oh,
I had applied, and then you had to go to school 4 months for public health training.
In Kentucky?
In Kentucky, so.
Plus in addition to your nursing.
Yes, right,
nursing.
yes.
Well,
it's
that's
completely
interesting.
different from public health nursing is so different from hospital and any other nursing.
Now, who paid for that? Did they?
They gave you a stipend of, but they gave us not much. Not enough to live on.
Where did you move back to Owensboro then?
No, Lexington.
You were in Lexington.
And I lived at the Y, and you know, the YWCA, and they, I had very little money because this was right after Christmas, and I wouldn't eat any breakfast, and I'd 2 or 3 times I passed out at 10 o'clock in the morning, and the doctor asked me if I ate breakfast, and I said no, and he said, well, I think you should, and maybe do without one of your other meals if that's necessary. He knew that's what I was doing.
Oh, Mary! So you went to work there with no money, lived at the Y.
Yeah, right.
And there was no money in public health nursing. There was no money in any nursing.
No. They gave us some kind of a stipend. I can't remember. Seems like it was $35 a month.
To live on.
To live on.
In
But
addition
that was,
to your salary. You remember?
no, you didn't get any salary. That was free.
You didn't get any
that
salary.
was part of school.
Oh, that was when you were going to school.
Yeah.
Oh, how interesting. Well, you probably were a little disappointed you left Kansas City, were you?
Yes.
When you first started out. But that was tough.
I worked in a newborn nursery in Kansas City that had 75 newborns. You know, in those days, the mothers stayed in the hospital
forever,
didn't 2
they?
weeks.
Mm-hmm.
And so it was really interesting.
Do you remember what they paid you out there?
Something like $75 a month. There was nothing back in those days. However, it's more than they pay now, I think. You know, it went a long way. Then if you were on duty, you got your meal free. And
did you live at the hospital?
No. Oh, you didn't?
You lived with your brother?
I lived with my brother.
So $75 went a long way.
Went a long ways then compared to what it was later.
How many hours long was your shift then?
8 hours.
It was 8 hours, so that had changed quite a bit in the 40s. They were treating us a little bit.
Yeah, they were starting to. I can remember some of the nurses, the private duty nurses and the older nurses, said during the Depression, hospitals didn't have money, and you know, and they paid those registered nurses $1 a day. They were tickled to death to get it.
Mm-hmm.
Of course, they got a meal while they were there at work, and they were so good to us. They just helped us any way they could. Mm-hmm. You know, they were the registered nurses that worked there at the hospital.
That's wonderful. Well, then back to Lexington then. Took you 4 months, and then what did you do when you finished your training?
I had my appointment to Bowling Green.
To Bowling Green.
The doctor from Ohio County had asked for me, and the director said she would send me to Ohio County, but it was not her choice because she didn't think that you should go to your own county when you first started. And I said, oh, please don't. I whipped everybody in McHenry. I was the oldest of 4 little kids, and if anybody touched them, I would just let them have it.
So you were spunky.
Yeah, I was. I said, oh, please don't send me there. They'll think I don't know anything. And so she said she intended to send me here anyway. And then we had 6 nurses here plus a supervisor, which was one of the larger counties in public health. Back then, public health was, it was hard to get into public health because very few counties had more than 1 nurse, and they stayed till they died or they retired. And it's very hard to get in public health, so that's why it took me a couple of years to get in.
And that's why you applied for appointments.
Appointment before. The ones that I talked to advised me to do that.
So this was about what year that you started in Bowling Green?
I was 1942.
Right in the middle of the war.
Yeah, right. Well, the war had started when I was in St. Joseph in Kansas City. I was on duty that day. We were on Pearl Harbor. And then that January was when I came to Lexington. That had just started.
So it was you and 6 nurses in Bowling Green. Did you have a building?
Yeah, we were at City Hall. We were on the top floor of City Hall. That's where the health department was. They had all the clinic rooms on one side, and then they had that courtroom in the middle, like it is now. And then on the other side were the business offices, where the doctor was, and all our desks were.
Public health nurses were highly esteemed,
Yes.
would you say?
Yes, we made a lot more than they did in the hospitals in those days. I think I started out at $165 a month. I thought I was rich.
I guess that was a lot more than.
Yeah, it was really great. It was much better than the hospitals paid at that time. Of course, you had to pay for your own car, and you didn't get mileage. You just paid for your gas, whatever it was. Of course, gas.
Had you already driven a car, so you?
Yeah, I learned. I got a car when I got my call to public health and learned to drive it. And I learned to drive on Thursday, and Friday I went to Lexington with a passenger from Cincinnati to Lexington. And then right after that, I got an appointment, and I knew that I had a job, and I had to have a car and had to learn how to drive. And I remember Miss East was our director, and I came through drove through Louisville, and she says, "Now, you're going to start on the payroll today, but I'm not going to let you go to Bowling Green tonight because of the Fort Knox traffic. So you just wait and go down tomorrow morning." I remember that because it was, a lot of tanks and everything on 31W. Then it was just loaded with convoys and all kinds of bombing.
And that old road, that was a
31W. Yeah. But I can remember her telling me that.
So then, did you live in an apartment?
Yes, I had an apartment. I had a room when I first came here. I had a room on Nutwood, and it was an older couple, and they had 3 bedrooms and a bath upstairs. And so she had those 3 bedrooms for public. I was a public health nurse. There was one with the Home Demonstration Agency and Farm Security Administration. Three girls up there. So every time they had a meeting, I went to theirs, and every time I had a meeting, they went to mine. I learned a lot.
That's
because
interesting.
they taught me, I'd go to these nutrition meetings. All this helped as a public health nurse.
Sure.
So I'd go to all, to all those things and I learned an awful lot.
So what was your main responsibility during those early days?
As a health nurse?
As a health nurse.
Well, of course, I was just a staff nurse. But when the federal government, there was only 10 counties in Kentucky that had this maternity nursing service, and that was because we had so many infant deaths and mothers that died. And so the main portion then was home visits to these prenatals, and there was no doctors here hardly. Very few doctors that all come to war. And we had a lot of responsibility. We'd go way out in the country, walk 5 miles, open 3 gates, and the homes were always way out in a field somewhere that you had to walk. And then we took their blood pressure, we took a urine specimen, we took their pulse and tried to listen to the baby. I had a hard time learning to listen to a baby's fetal heart, but if the mother had any problems, swelling or bleeding or anything, we'd have to walk back all that distance because you couldn't get out there in a car, and call a doctor and find out whether we should bring them in to the hospital or what should we do. And many times I brought a patient in my own car because they had no way to get here either.
Oh my goodness. Well, who did the actual deliveries?
The doctor. We had private doctors. It was 3 or 4 older doctors but we have Dr. London out at Woodburn and Dr. Helm at Smith's Grove, and there was 2 or 3 in Bowling Green. Dr. Moss, I guess I delivered hundreds of babies with him. Dr. R.C. Moss, M-O-S-S. And we'd be on call 1 week at a time. One time I was on the same delivery 3 days a night. But, that was my fault. If you were tired and felt you needed relief, they would send somebody in your place. But otherwise, they'd let you stay.
So you just stay out there with the doctor till the baby
No,
was
the
born?
doctor would leave and then, come back. He'd call me every so often, but I'd stay. And
Did you have a lot of babies that you delivered yourself that way?
I delivered 1 set of twins, but it was not because I was making my regular monthly or 2 weeks. We went every month for 7 months, and then every 2 weeks the next month, and then every week the last month. And we taught the mothers how to prepare all their sterile things and pads and everything. I made out of newspapers, and how to sterilize them in the oven. And they had 20 thicknesses of paper and then cheesecloth or something like that on top of that. So we had a bag with all of our sterile supplies, and they had their things that they had to prepare. So it worked out real good. We would hardly ever have any problems with their bed or anything. Just throw it away. So it was really interesting. It was really great to learn. But we had a lot of responsibility. Then when this Dr. Helm we weren't supposed to go to other counties, and he was a whiz at delivering babies. And it was 20 miles out to Smith's Grove, close to it, 18 I think it is now. But I've gone out there as high as 3 times in a night in snow. I wouldn't do that now for anything. But we'd go across the county line. We'd deliver sometimes 3 or 4 babies in one night. And I'd say, Dr. Helm, you're not supposed to go into Edmonson County or Barron County. He'd just laugh and keep on going.
Did you ride with him off the time?
Yeah, I went to his house to meet him at his home in Smith's Grove, and then we'd go in his car. One night he got out after I'd been out there twice. He got out, got his bag out of his car, and was going to put it in my car. I said, what are you going to do? He says, I'm going with you. And I said, no, you're not. I said, if you go with me, I won't have enough gas to get back to Bowling Green. I think the cars had 13-gallon tanks or something then. So he had to open the gas station to get fuel for us to go make the deliveries. And there's never been anything that smelled as good as that coffee brewing on a cold stove. And they just boiled it. They didn't perk it or anything, At 5 o'clock in the morning, you needed something to keep your eyes open, and boy, that would smell
They'd
so
have the
good.
coffee.
Yeah, they'd have the coffee.
They give you some food, some biscuits.
Oh,
and stuff.
sometimes they try to, they want you to eat. Some of those farmers had good food. Some of them didn't have much, but
Yeah.
some of them had their own.
Oh, how interesting! Lots of responsibility.
Oh, yes.
Well, when did your roles? What were some of the other nurses that are any of them still around that worked
No.
with you?
Teresa Higgins was her name. She married a Barnett. She lives here. She worked for mental health, came back here. But none of the rest of them, Miss Rubel and Miss Stoner, and Miss Sanderson, and Marie Boone was my supervisor. She had gone to Cleveland to a public health school, and she was our supervisor.
Did you ever think of going to midwifery school after doing all that OB?
Oh, I would have loved it. That's what I told you. I was born 20 years too soon with all the things.
You'd have liked to have
And
done
public
that.
health, the girls, the midwives from the health department, they just loved to sit and listen to me tell about
Oh,
when
the
we used to
stories.
deliver babies in the homes. Of course, they delivered babies in the hospital. We delivered babies in the home. But the grandest thing that, I guess the most miraculous thing that ever happened to me was a little 15-year-old girl. Have I ever told you this story?
No,
Was in labor out around Plano. And Dr. Freeman, he's another country doctor that delivered babies. We had several, that lived in small towns around here. And he was the doctor, and he was in his 70s, I guess, at that time. And the baby was transverse. And I gave the mother ether. He went in and turned that baby. That now you'd have to have a cesarean. And the baby was born, well, just about dead. It was so cyanotic, it didn't breathe. Its heart wasn't beating. And we put it, in those days, you put them, shocked them in hot and cold water. And I milked the trachea. The baby still didn't breathe. And we had an emergency bag that had several kinds of drugs in it. And I opened that thing and spread it out, and I said, Dr. Freeman, which one? He said, this one. It was alpha-lobelia, and I don't guess I ever used that medicine again, but I still remember what the name of it was. He wanted me to give it in the heart muscle. And he showed, I said, where? And he showed me. We gave that baby that medicine in the heart muscle, and the baby's heart started beating, and the baby started breathing. You have never seen grandparents hug and kissing anybody as much as they did us. And that little girl is the wife of the man that owns Johnson, Hetty Johnson, not Hetty Johnson, what is it, Johnson, Vaughn. And it's Mrs. Vaughn.
Well,
And
isn't
she has
that
all,
something? And that baby was that you
this-
brought to
that's,
life.
That's
Oh,
the
Mary.
wife of Mr. Vaughn.
Oh, isn't
And
that
that one day we were down here in the summer. I was at, the mother and father evidently kept telling that little girl that I saved her life, which I didn't, God did, and the doctor did. But I was at Woolworths, and this little girl, 8 or 10 years old, came up to me and she says, aren't you Mary Halstrom that used to work in the health department? And I said, yes, who are you? And she told me her name. She says, you saved my life. And it has, the day I had my retirement party, that morning I had gotten the most beautiful card from this little girl's mother, and it told all the things that I did. I wish I had it. I've got it, but it's down in all this stuff. And that we did that day, and how thankful she was, and how this little girl had grown up to be such a wonderful citizen and everything. That afternoon, when we were having the party, it was almost over. The florist delivered an artificial bouquet, and most of it was baby's breath. The tears just started flowing because the baby's breath, of the baby's breath, it was just the grandest thing to do.
Oh, goodness.
And someone asked me, said, did you give the baby mouth-to-mouth resuscitation? I said, I don't think so. I said, I don't guess we even knew how to do it then. And I was talking, I called the mother up to talk to her. She said, yes, you did. Said you put a piece of gauze over her mouth and gave her, blew into her mouth.
That was before you did
before I did the other. We did everything before we did the other.
Oh my! And today they would tell you that was probably the worst thing you could have done.
Yeah,
was
right.
Put them in hot and cold water.
Yeah, right. Yes. Oh, we did that 2 or 3 times to shock them,
to try to get them to breathe.
After the doctor spanked them and couldn't get them to cry, and you'd hold them up with their feet.
That was a cardiac stimulant.
Yeah, that's what it was. It was a stimulant, and it was just evidently. The doctor didn't give up. He just knew that he wanted to save that little baby, and we did.
And he was 70 years old.
He was in his 70s.
And the mother was 15.
Yeah, the mother was 15 years old, and she had this little precious baby. I think the baby was big enough. I think it was about 5 or 6 pounds. It wasn't a premature.
Goodness.
But I think she'd probably been in labor so long. I don't know what
Stress.
Well, first I want to tell you, but when I first came here in clinic, we had 600 syphilis cases. A lot of them were congenital. And of course they couldn't give it to anybody, but we treated them for 18 months.
600.
And of course, now penicillin clears it up. The ones that can take penicillin, and they have other drugs to take care of that. But of course, we have all kinds of new sexually transmitted diseases that we didn't have then. Gonorrhea was about the only thing then that you had to treat.
So what kinds of different things did you do then? Did you move from OB into something else?
Well, we did that too. We did OB, and we made home visits and gave immunizations to all the children. Went to all the schools. We had districts, and everything in that district was yours. All the TB cases, all the VD cases, all the schools, all of these things were part of your responsibility. And at one time, I had half of the city and half of the county. And I'd make 15 or 20 visits in one day, and then they'd be there at the health department. They had to have something done in the morning before I'd go out. When I'd come back in the afternoon, I'd have the office full waiting for me to give them their shots for work or whatever had to be done. Because we didn't have the general clinic open every day like they do now. And so, but we'd have it like 2 days a week, and then these other people would.
How long were your days then?
They were 8 hours.
It sounds like you did an awful lot of 8 hours.
The people would get in the health department at 4:30, and you'd still have. They'd say, "Am I too late?" And I'd say, "If the door's open, you're not too late."
So you'd work overtime.
So we'd work till 5 and 5:30 lots of times to get the. And we had to do this follow-up on all. We had a lot of tuberculosis cases, and we had a lot of that, and we had a lot of prenatals, as I said, we had to go see. We had. I'd run into emergencies in the homes, and I'd have to see that they got to the hospital or got to a doctor. The mothers wouldn't even realize that their babies were that sick and so forth. Or if they got hurt, I put splints on and made butterflies and dressed their wounds. You just name it, we did it. Now I'd be afraid to do it because there's so many lawsuits.
Well, I remember that in the old public health days, and they taught you how to go into the homes and turn your coats inside out so they wouldn't touch anything. And they got real conscious of germs. Was it in the 40s?
Right. Yes, right. That's exactly right. And then on top of that, some of the homes would be so dirty there would be no place for you to put your coat, so we dig in the car. And Dr. Moss, the one that would go, and he'd say, talk real slow, and he'd say, it's a good thing there's cracks in the floor to let some of this filth out. And then they had bed bugs at those the times, and you were scared to death and take them home with you. But one day a week during school, I was in some school checking children for head lice. And then we still have it, you know, when they had DDT that they sprayed them with, and it went away for 10 or 15 years. And
now they're back again.
And they're back again.
Well, there have been a lot of changes.
Now at the health department, we do everything. There's, you know, we have the Well Baby Clinic. I started the family planning clinic. The first family clinic was started in this county. Georgia Lucas and I started it. We went to everywhere trying to get somebody to sponsor us, and finally the state did. But it took them years. That was 1967. And we had the first family planning clinic there was. And there was a businessman in this town that used to buy birth control pills. If welfare would send them to him, he had a charge account at the drugstores. And they'd get birth control pills free through the welfare. Of course, that's not the way to give out birth control pills. So after we started our family planning clinic, he sent us a list of all the patients that he was buying the birth control pills for. And at the end of the year, he wrote us a congratulatory letter saying that not one, I think it was 20 patients, not one of those 20 patients had had an unplanned pregnancy that year. And he thanked us so much.
So it was one of the physicians?
No, it was a businessman.
A businessman?
It was Chess Johnson's who it was. You know, he used to have a photo store here. And he also, I knew him real well, he worked as a VD investigator during World War II.
So he was just getting them for his friends?
And he was doing it because he didn't want unplanned pregnancies in these people that...
It was still very controversial.
Yeah,
right,
yeah,
that kind of thing.
Yeah.
Well, that's interesting. So you started, what year did you start in Bowling?
To work, 1942.
And you continued till what year you retired?
I was here from 42 to 45, and from 45 to 55, I traveled with my husband in the service and had 3 babies.
For 10 years you left?
I was out, and I came back in 1955, and I was out one other year. Went on, I call it my sabbatical to Europe with George for a year in Germany. And that was 1960-61, and I came back and stayed till 83. So I had a lot of breaks, but I had
a long tenure there.
Yeah, from 42 to 83. It was 41 years, and I had 30 years in there.
What was the most significant change?
I think in the whole, first of all, when I came in public health, people were very, very poor. There weren't very many well-off people in those days. And we didn't have any, we had one little city and county welfare center. That's the only help they had. And then these last 10 or 15 years, we haven't had the hunger and the emaciated children that didn't get the food they needed because we have all these government programs that give them the things that they needed to have. And when they come through, we have such a wonderful prenatal clinic with the midwives and such a wonderful follow-up for them. And if there's any problem with the mother and her health, then that's given to another public health nurse to follow up and see that she gets to make home visits and see that she gets the things that she needs to eat. And
with WIC and all that.
Yeah,
stuff.
WIC, WIC, and then most of them get medical cards now.
So things have improved a lot.
Oh, they
I
have,
think
and
some
we
people
have the
just
well
don't
baby.
realize how poor and destitute people
Oh,
were
they
in
were.
the 40s and 50s before
Right.
these social welfare
That's right.
programs.
That's exactly right. And then, you know, our country has become so prosperous. We went to see Roosevelt's summer home in Georgia last year on our
Oh,
way.
you did Warm Springs?
Warm Springs.
Uh-huh.
And I told my husband, I said, I bet, you know, he was born a millionaire. You know, but his place down there, of course, he only went down there for his baths and things, on the polio. But I bet in his wildest dreams, he never thought that this country would ever be so prosperous. And he started.
But I think,
of course, the war started.
I think we're getting a bigger split between the poor and the wealthy.
But the poor now are not near as poor
As
they were then. Because the poor then, it was hard to even get milk for or anything to eat. And I've gone into some of those homes and we delivered babies. There would not be any food in the house.
Nothing to eat. Well, that is a big change in the whole society, and I'm sure you've
Yes,
seen.
right. And the health department has so many wonderful programs for the geriatric and for the well babies. I think one of the grandest things we've ever had is when we started the well baby program. The parents seem to take an interest when their babies are not growing right. They can see it on the chart, and we can explain it to them.
Yeah, I think that child is
And
wonderful.
it is really great. And I think the mothers, when they're carrying their babies, get so much better care. And now, of course, they've got the primary care that I used to complain and worry all the time because we didn't have any help for the people between prenatal age and Medicare age, because there was no free programs for them. Now, of course, it's not exactly free, but
They can get some.
yeah,
attention.
well, they can get it even if they don't have the money at the primary care.
When did you join K&A?
When I got out of high school, nursing
Out of
school.
nursing?
When I was in nursing school, K&A met in Owensboro. And that's the only K&A I went to till in later years. And it was just the grandest thing that ever was. And our instructors, including Miss Turner, they preached it all the time. That you just didn't practice nursing unless you belonged to K&A.
It was just expected.
It was expected.
You were
And
a
they talked about it the
professional,
whole
you did
time.
that,
And I belonged to it for years and years. I even paid my dues when I wasn't working until somebody, American Nurses Association, absconded with, I think it was $1 million or something, back 20 years ago or something like that. And they raised the rates from $17.50 to $35 or something like that. And so I didn't pay my dues for about 6 or 8 years because I had the car. And then I went back to it. I never felt good not being in it and part of it. And you know, back then we had a meeting at Glasgow one month and a meeting here, and we had big attendance.
What do you think the attendance drops off for?
I
Because the dues
think,
is so
I
high.
think that was the main thing. I think that's what started it. And then it seems that the younger nurses are not interested in it.
They don't have that same sense of loyalty.
It doesn't. The hospital, you know, if they're trying to get a raise or something, they can join, but they don't. I don't know why.
Stick with it.
I don't know why. And you know, Carol Kirsten and myself, I guess, were the only ones from the health department that belonged to it. Nobody else joined. And I've always enjoyed it. I enjoyed the meetings. I enjoyed the programs. And one thing I think that the girls nowadays, I think you have to know that all of the young girls are married. They all have little children. They all come back to work when their babies are 8 weeks old. And you can't expect them to be super moms. And that's what they are.
Mm-hmm.
They work so hard, and I guess just to tell them that they've got to go to another meeting just turns them off. And I'm sure it would me.
Mm-hmm.
Because they're good nurses, and
They work hard during the day, and then
and then they have responsibility at night with their family. That's the only time they can be with their children.
Oh, I think that has a lot of it. When I worked at the hospital,
Don't
has
you
a lot
think?
to do with it.
I think that's.
You did. You gave it all.
Oh, yeah.
All day long, and then
I've
you went home
always
and had a
said
family.
that when you're a nurse, it is almost too much to be married.
And that's maybe why in the past a lot of the nurses weren't
Yeah,
early nurses.
because your whole life is devoted to your profession.
Mm-hmm.
And when anybody said, I need another nurse to do another shift, somebody took it.
Oh, they always do.
Oh, yes, somebody took it, and it just, when I think about it now, I just think, how did I ever do it?
It was hard to work and have a family. And I think maybe some of these younger nurses are maybe learning to balance things a little better. Maybe they're not. I don't know. It's interesting. We can think about what it's going to be like in the year 2000. But it's
I
kind of
think
hard
there'll be probably more nurses practicing than there are doctors in private offices. Do you think?
Oh yeah, I think there will be more nurses in private practice.
And I would have given anything to been able to do some of that because I've been told, when one year we had the public health school here, like I went to Lexington, we had it here, and the nurse that was in charge, when they said they were going to move it back to Lexington, I said, I'm glad. She says, why has it been curtailing your practice of medicine? Because you did a lot of things that I wouldn't do now. You had to.
And they expected it.
They expected it.
And people were not sue conscious.
No,
and
they didn't.
You never
No.
thought about anybody.
No. I always had malpractice insurance. I never went to work a day without having malpractice insurance, but they also told us in those days not to tell people you had it.
Yeah.
Now everybody tells it, I guess.
Well, it's not a high-paying occupation, but it certainly is.
It is
It wasn't
fulfilling.
boring, was it?
I-
A minute of it.
I would not change my life for anything. I was born into a big, happy family.
Mm-hmm.
I married the most wonderful man in the world and had 3 beautiful, wonderful children and worked in my job for 31 years.
And you never minded going to work a day.
Never minded. In fact, I looked forward to it, and I always went to work an hour early. For all those years, I went to work at 7 o'clock instead of 8 o'clock, because I'd go pull my records, when I made home visit, I'd get my biologicals and everything in my bag, and then the little bucket we took, the little fishing bucket with ice in it, with all of our serum and everything in it. And then I'd sit down and work on yesterday's records for 2 hours, and at 10 o'clock in the morning, I'd go make home visit.
You're ready to go.
Yeah. And at 4 o'clock, I'd be coming back in.
You did later, in the later times you worked there, you did the school.
Well, we always did the schools. Ever since I've been public health nurse, we always did the schools.
But what was your particular role towards the end of it?
I was in charge of geriatrics.
Oh, you were.
I had a geriatric screening clinic on Mondays and Fridays, and then I had a geriatric medical clinic on Tuesday. And in between, I was in all the other clinics. Took my turn in general clinic. In fact, I was in charge of general clinic and ordered all the vaccines and all those things.
So your gamut went from the very newborn.
From the cradle to the grave.
It did, didn't it?
Yes.
Is there any one group of people you like working with
I think when I look back, I think the thing that I miss most are the babies. Because I started out with the babies, and I think when I go down and see them, you know, I go on Mondays to volunteer. Yeah.
Oh, do you at the health
At
department?
in the geriatric clinic. And when I'm out there in the lobby and all of them, those young mothers, ones that I probably helped bring to the world, well, of course, that was, I'm on the second generation of those children. They're all, a lot of them married, but they'll just smile at me, you know, they knew I gave them shots and things. And it just, I said, I think the thing that I really miss, the babies. I love to go back and take care of the older people. I always told Carol that I wish that that was my only job, was to take care of my geriatric age patients, because they had so many problems. And they'd call me, and I needed to go to their house and see what I could help them with. But I'd be in a clinic and I couldn't go. But they need all kinds of help.
Well, that health department down there, they have a good attitude there. It's a nice
Oh,
group
yes.
to work
Isn't
with.
it wonderful?
Uh-huh.
I think that that was one of the things, you know, we went from, when I went back to work in 1955, we had 3 nurses.
3. And
Three.
it gone down from 6 to 3.
3 nurses. And then it stayed that way for 6 or 8, maybe 10 years. And then these government programs started, and Mr. Hume was here, and he took advantage of every one of them. And then we got like 25 nurses back there, at least 20 in one room, plus all the others that worked other places. You know, so we had specialists in every field. You know, of course you couldn't be everything to everybody, and when we got a TB team, I'd turn them over to that. One of the social workers, Nancy Carcelino, she said that she always remembers, she was a social worker and had 3 or 4, you know, was on a 10-county team or a regional team. And she said she always remembers how good I was to refer my patients to them. And I said, are you kidding? I was tickled to death to have somebody to take over those things. When they wanted to take care of the TB patients, the VD patients, the social work, I was thrilled because I knew I couldn't do it all.
Yeah, and so many years you'd had to do it.
Yes, right.
Oh, goodness.
For 10 years, I gave every speech that was made in the health department. I'd go in the school, the home ec classes at school, Bowling Green High. First day of school, they'd be fighting to get a hold of me because they wanted to schedule me to teach family planning and the birth of a new baby and all that to their home ec students. And I tell you, it was.
Did you get a lot of kind of bad press or any kind of outright negative comments about the family planning kind of thing?
Yeah, some.
Is it this 1967?
Yeah, it was quite a bit. Of course, they had to be married then. You couldn't.
Well, you had to be married to get.
You know, to get into the clinic, and it was really. And I can remember, you know, soon after that they started giving condoms and things to the men, and I turned one away, the first one that ever came to ask, because I was never told I could do that. And Mr. Hume, he really gave me a bawling out. He said, I know that boy that came here is the father of 3 illegitimate children in high school right now. I said, Mr. Hume, I'd give him a whole box full if I thought it was okay for me to give it. I'm glad you told me.
So then they started doing it.
And so then they started doing it. See, those are the things. And you know, the social services would send us up there, and we'd have to turn them away. It was just sad. But then, you know, demand brought it all out in the open. And so.
Oh goodness. Well,
And I've left birth control pills out in the flower box, and they'd call me from school, and their parents didn't know they had. We were not allowed to tell them that their parents were getting it. You know, that the child was getting birth control pills. And I've even brought them home and put them in my mailbox, and they come here at night and get them. I've told them in my Sunday school class, I wonder if the Lord will forgive me for all those things that I did.
Well, Mary, you know.
But you know, I didn't want them to miss their pills. They were on them, and if they went off of them, they'd be pregnant. I didn't want them to miss their pills, and they were ordered by a doctor. It wasn't that I was giving them illegally.
Yeah.
It was just that the parents didn't know they were getting them. And they didn't want anybody at school to know, so they'd sneak and call, during the day. And they couldn't have any way in here until, after the office was closed. So that's why I put them out in the flower box and tell them where I put them, their supply, and all those things.
Well, goodness. You had a full and
I
happy and
did.
devoted life to
I
this
have this.
profession. And I just hope that the nurses in the future will be as devoted to their occupation.
And the Western students all came here, to the health department. When it first started, we had a Western student for every nurse that was on staff. And we took them with us to make home visits.
See, that was in '60.
And they came 2
In the
days a
60s,
week.
isn't it?
Can you imagine? It's wasted 2 days down there every week of the world. You couldn't do that now.
No.
But anyway, I got one girl married. The instructor would come down and assign them who she wanted them to go with. So after she left one day, I wanted this girl to meet one of the people that came out of the State Department of Health, a young, good-looking boy, and she was a good-looking girl. And
So you were a matchmaker.
Are you kidding? I changed her duties from that day for who she's supposed to go with to him. And he took her. He was a sanitarian or milk or something. I forgot, milk engineer or something. I don't know what he was, but whatever it was, I changed her duties from whoever she's going with, because I was sort of in charge, after they left. And did you know they didn't like each other at first, but about 6 months later they started going together and they got married.
Did they ever come see you?
No, I don't even know what their names are anymore, but
They did.
I knew they got married. She came down and showed us her engagement ring and everything.
Oh, Mary.
I waited in where angels feared to tread, I can tell you.
Oh, that's great. Let's see if I missed any important things here on this list. Were you ever president of K&A?
No, I never did want to be.
Well,
But I had a whole lot of other offices,
Uh-huh.
membership committee and all this kind of things, but I never did. I had 3 children and my husband was in service, and I had a lot of responsibility. In fact, our health officer tried to get me to go back to Western to get my BS on company time, health department time. And I said, but I could go on your time, but how am I going to stay with 3 children? I had to take them everywhere. They were all in band and all these things. I had to be their chauffeur, and I just didn't see how I could do it.
Well,
But I always wished I could have.
You did a lot.
I always wished I could have. I always wanted to. Education is everything.
Well, it does. It
I
helps a lot.
I would run into things and I'd say, I'd just give anything I could have a course in that at Western.
or anywhere.
Yeah,
sure.
right, yes.
Okay. Well, thank you, Mary. We have certainly enjoyed this interview today.
I appreciate you asking me.
Okay.
I've enjoyed it.